outbreaks. So these are the conditions where there is an emergency treatment is required, and you should give a proper treatment for the patients. Next one is the leadership in a global health policy. Like nurses should contribute to the policies development by advocating for the universal health care and for the better working conditions. So you should address everything. You should take up the leadership to tell the what are the different policies in the healthcare system for a better working conditions for the healthcare professionals. It is clear. What are the nurses' role in the socio-cultural context? Please read it once.
It's clear, Mom.
Just read it once. This slide is over. Is this over?
Sorry, Mom.
Okay, then read this one.
Can't get you well.
I'm asking you to read it once. Like whatever I have discussed, I'm asking you to read it once. Just read it once.
The public health advocacy.
Yeah.
Okay.
So this is the role of a nurse. Like you should advocate your patients or the public people to have a proper education on providing, maintaining a hygiene, then taking vaccination on the right time, to have a proper nutrition in the unreserved communities. Like that, you should advocate your people, patients. Okay.
Okay.
These are the role of a nurses in the cultural role of nurse in a delivering the treatment. Like you should understand your patient properly, what are their requirements, what are their beliefs, you should understand. Then you should have a proper communication with them. Like in their own language, you should communicate to the patient, and then you should treat the patient. Then you should address people, those who are living in the poverty, people who are not getting proper education. Then you should see the gender equality also. Like you should give equality in the treatment also. No matter whether it is a male or female, everyone should be treated equally. Clear?
Okay.
Yeah. Then in the disaster and the human like wherever there is calamities occurring, where there is an emergency requirements are there, like COVID-19 breakout, Ebola breakout, in such conditions also, a nurse should play a critical role. They should go and they should treat the patients. Then you should have a leadership and in the global health policies, like you should contribute to the policies, and you should ask them to reform, make changes, or what are the requirements in the healthcare system. You should tell them, and you should reform, or you should change the healthcare policies for the better working condition of the medical professions. Understood? So this is how nurses play a critical role in the treatments. Is this much clear?
Yes, Mom.
Okay. Now we'll move on to the next one. That is, what is the importance of this sociological and anthropological researches in the healthcare system? Okay. So medical sociology, as I told you, it is the study of social determinants and its effect on the health and the illness. Whereas medical anthropology was the study of culture and the other biological factors which can influence the health and illness and the healthcare system. So why their studies are important, why it is matter is because in order to understand a human's behavior, what are the different cultures they believe, and what are the social dynamics which are required to enhance the healthcare delivery. That is why you need to understand or you need to research on medical sociology and anthropology. This is why medical sociology and anthropology is important for the nurses, so that you will have a better understanding of the behavior of a human in a society, and how they believe in their different cultures, and how they are ready for the treatment, and how to enhance the overall healthcare delivery. So for that thing, you need to understand, or you need to research on medical sociology and medical anthropology. Is that clear? Is that clear?
Yes, ma'am.
You just read it once. Just read it
Sorry.
once. I request to read the slide once.
Medical sociology,
Yeah.
which is the study of social determinants and effects of health and illness.
Okay.
The medical anthropology,
Read. This is a study of.
the study of cultural and biological factors influencing health, illness, and healthcare systems.
Yeah. Now, why it is important?
It's important in understanding human behavior, cultural beliefs, and social dynamics to enhance healthcare delivery.
Very good. Fine. Now we'll see what is the importance of sociological research in the healthcare. Okay. So sociological healthcare research is important. One, to understand the health inequalities. As I told you, there are various health inequalities as going on. So to understand what are the different health inequalities, like what is the impact of socioeconomic status, gender inequality, ethnicity, or in all to understand this, you need to you need to have a research on the medical sociology. Second thing, to understand the patient's behavior and the complaints, like how different social norms in the sense different standards will influence the health practice. Like usually high rich people will get the proper health practices, whereas poor people will have less access to the health care. Then health policy development, like how to shape the policies that can address the public health concerns also. Like how and all you should address the healthcare policies for the poor people also. Then improve doctor-patient relationship, like build up a trust and empathy. Always your medical profession should show empathy to your patients. Like you should always build a trust between the patient and the doctor, or patient and the nurse, so that they can communicate to you easily, and you can also respect them and show them empathy and can give them a proper care. Understand why there is importance of sociological research on healthcare, in order to understand what are the different inequalities going on in the health side, how the patient behavior and how the health policies has to be shaped, so that everyone get the address to the public health, and to improve the doctor patient relationship, so that they can build up a trust and show empathy to the patient. Understood? Understood?
Understood.
So what is the importance of sociological research in the health?
To understand the health inequalities.
Yes. Then
To understand the patient's behavior and compliances.
yes. Then
The health policy development.
okay.
And improve doctor-patient relationship.
Very good. Now we'll see what is the importance of anthropological research in the healthcare. Okay. So anthropological research is important to understand the cultural competency in the care. Like you should respect the various diverse healing
Cultural
practices.
competency in care.
Yeah. So you should respect the different diverse healing practices. As I told you, some believe in spirituality, some believe in fasting, some believe in the medical practice. So you should respect everything. Whatever your patient believe, that you should respect them. Then to provide a holistic health approaches, like you should address physically, mentally, and social well-being of the patient. Not only you should address the only the condition, you should address them both physically, mentally, and for the overall social well-being. Then community-based healthcare, like it should be tailored interventions for the local population also. You should give the better treatment. Then, for understanding the stigma, as I told you, there are different cultural perceptions of diseases like AIDS, HIVs, and mental health. So, you should remove that stigma things and you should understand the people's concern. Understood? For this, anthropological research is important. So, what are the importance of having anthropological research in healthcare? What are the importance of having anthropological research in healthcare? Read it. What are the importance of
Sorry,
having
ma'am.
anthropological?
It's for cultural competencies in care,
Yes,
holistic health approaches,
yes,
for community-based healthcare,
yes.
and understanding stigma.
Very good. Now we'll see one case study in the medical sociology. Okay, one case study in medical sociology and one case study in the medical anthropology. So one first case study is that impact of the socioeconomic status on the access to cardiac care. So this is the condition. Okay, impact of socioeconomic status on the access to cardiac care. That means socioeconomic status like poor or rich people come to get a access to the cardiac care. So here the background is socioeconomic disparities lead to unequal access to the advanced cardiac treatment. Like as I told you, those who are rich people will get the access to the medical advancements, whereas poor people has no approach to the cardiac treatment. So here also the background is because of the social economic disparities, it lead to unequal access to the advanced cardiac treatment. Now the finding here is that the low income group experience delay in the treatment because they don't have income. And because of that, they face a high mortality rate. Whereas those who are having high income will get the medical treatment and there will be high life expectancy. So what is the implication here that should happen? It is the policies should be developed so as to ensure there is equitable health access to both the critical sides. Whether it is low or poor or whatever it is, everyone should have a equal accessibility to the healthcare. So that should be the implication done in the condition. Is this case study clear?
Yes, ma'am.
Okay, just read once.
A case study, medical sociology. That's the
Hmm.
first case study.
Hmm.
The impact of socioeconomical status on access to cardiac care.
Okay.
Here we have the background, influence of the background findings, and implication.
Okay. Implication is policies should be formed to ensure there is equal care access for the critical patients,
Yeah,
those are living in lower or in any condition. Clear?
okay.
Next is a case study in a medical anthropology. So here the condition is that there are cultural beliefs and maternal health practices in India. And here the background is traditional beliefs affecting the childbirth practices. So here the finding was that they preference for home birth and recurrence to use modern medical facility. Like people believe that if they give birth at the home, it is far better that is than going to the medical facilities. So here what implication should be done is culturally sensitive education program should be given, which can improve the maternal health outcome. Like for these people, you have to teach them what are the requirement, what are the emergencies which can undergo, and why they have to come for the medical health accesses. Clear?
Clear.
Yeah, just read it once.
Okay, case study 2, medical anthropology. cultural beliefs, and maternal health practices in India. The background, traditional beliefs affecting childbirth practices.
Okay.
Findings, preference for home births, and reluctance to use modern medical facilities, which implies that cultural sensitization or sensitive educational program can improve maternal health outcomes.
Okay, good. Next is integrating socio-cultural insights in the nursing practices. So in your day-to-day life practices, how to integrate this various social cultures. So that's what we are going to see. So one is cultural sensitivity, that is tailoring care to the respect patient's belief. That is, you should respect your patient's beliefs, cultural, traditional, whatever they say, you should respect them. Second thing, effective communication. So being a nurse, you should have a effective communication should be given. That is overcoming the language and cultural barriers. If you don't know, when you're working in different states or different places, you should learn their language and you should try to communicate with them so that you can overcome their cultural or language barriers. Third thing, you should always concentrate in the patient-centered care. Like you should consider what are the social backgrounds in the treatment plans, and you should always concentrate in the patient-centered care. You should not look on whether the patient is rich or from a high income state. No matter whatever it is, you should give them equal treatment. Then community engagement, like nurses should bridge between the healthcare system and the different communities. You should not have a barrier in between. You should have a bridging between the healthcare system as well as between the various communities. So these are how you can integrate the socio-economical insights in the day-to-day nursing practices. So once again, you should always have a cultural sensitivity, like you should respect your patient's cultural beliefs. Second thing, you should effectively communicate with the patients. You should not have any language or cultural or any sort of barriers. Third thing, you should always have a patient-centered care there in your mind. Always respect your patient and have a proper treatment. Then community engagement. Like nurses should have a bridge between the healthcare system and the communities. Is it clear? Is it clear?
Yes, ma'am.
Okay. Next is evolving the healthcare needs and challenges. As I told you, globalization has addresses the health challenges across the cultures. As I told you, globalization has got a positive impact also as a negative impact also, right? Positive impact, so it has addressed the overall health challenges across the culture. Second thing, aging population. Always the socio-cultural care models for elderly patients has to be taken. You know that elderly patients will have various health issues and everything. So those people has to be taken in account and has to be given a proper care in the medical profession. Then chronic diseases like lifestyle focused in the preventive care should be given. Then mental health like reducing stigmas through the socio-cultural understanding. You should make an understanding among the various patient parties to remove that stigma thing. Then these are the future trends which will come in the medical sociology and anthropology. For example, the first trend that could come in the future is digital health sociology. So digital health sociology will examine how the digital technologies will have an impact on the health behaviors. And what the nurse should implicate is nurses should be need to train in this telehealth and digital patient care. For example, if a patient call you through a phone call, they can ask you for the treatment. So you should be trained enough to give a digital patient care. Understood? So this is what digital health sociology means. Understood?
Okay. Okay,
Okay,
ma'am.
the next trend will be a global health perspectives. Like with this will focus on the cross-cultural health issues in a globalized world. And here the nurses should have must develop the cultural competence for the diverse patient. You should understand what are the different beliefs, cultures, and you should develop your cultural competence to treat the patients from different cultures.
Okay.
Then aging and geriatric care, like socio-cultural factors which can affect the aging population. Obviously, the aging population will have different health conditions. So, being a nurse, you should implicate, like you should enhance this geriatric care training and community engagement. Like obviously, the aged people will tend to make them sit in somewhere, right? They don't come out of their houses or rooms. So you should engage them in some activity. You should engage them with some physical activities and everything. Then next one is mental health awareness, like shifts in the societal views on the mental health and wellness. Like you should emphasize on the mental health literacy and you should give a holistic care models. Like you should give them classes or trainings on how to emphasize on this mental health and you should provide them with a holistic care. Then pandemic impact studies, like you should analyze the long-term social impact of the global pandemic and nurses should prepare for the public health emergencies and resilience. Like anytime if you are called out for any help or services, you should go to that pandemic area and you should service the people. Understood what are the future trends which can come in the medical sociology and anthropology? Can you just read one by one trend, description, and implication?
Okay.
Yeah,
My
just
screen
read
is
it.
really small. Let me
Yeah.
try to increase it.
Now we can see.
Okay, digital. Okay, digital health sociology. The description, it examines how digital technology impacts health behaviors,
Yes.
implications for nurses. Nurses need training in telehealth and digital patient care.
Good. Next one.
Global health perspectives focus on cross-cultural health issues in globalized world. Nurses must develop cultural competence for diverse patients.
Yes.
And then we have aging and geriatric care. Sociocultural factors affecting aging populations, enhance geriatric care training and community engagement. Then we have mental health awareness.
Yeah.
Shifts in societal views on mental health and wellness. Emphasis on mental health literacy and holistic care models.
Okay. Last one.
There we have pandemic impact studies, analyzing long-term social impacts of global pandemics, preparing nurses for public health emergencies and resilience.
Yes. Very good. So these are the upcoming future trends you can see in the medical sociology and in the anthropology. Okay. Next is
Thank
the
you.
future directions. Right. So if you see the future directions, so one thing you should
Okay.
have a interdisciplinary training should be given. Like you should incorporate the social cultural education in the healthcare curricula. So when you are learning everything, you should keep this in the mind that you should have a interdisciplinary training incorporating all social cultural educations in the healthcare curriculum. Second thing is policy development. Like there are different policies. So advocating for inclusive healthcare policies should be given so that every people has an accessible to the healthcare system for their treatment. Then research opportunities should be given, like exploring the intersections of the culture, society, and healthcare technologies should be given an opportunities. Then technology integrations, like addressing the digital health disparities through socio-cultural perspectives also should be given. So in conclusion, sociology and anthropology provides an essential framework for understanding the health behavior, and culturally informed practices can lead to better health outcomes and patient satisfaction. And interdisciplinary approaches are the key to meet the evolving healthcare challenges. So, with this, your medical sociology and anthropology has come to an end. So, I hope you understood the class. So, for the exam point of view, you should learn what are the future trends in this medical sociology and anthropology should be learned. Okay.
Okay.
Then you should know the case studies also. Medical sociology and anthropology, one case study you should learn. Then what are the nurses' role in the socio-cultural context is important. Like you should
Okay.
have various roles. Like one is how to give a sensitive care. That is, you should understand your patient condition, patient preference, then proper communication, advocating the public health regarding the hygiene, progress, neatness, everything. Then how you should act in case of a disaster management, or how you should have a leadership. This is also an important topic. Okay. Then
Okay,
what are
ma'am.
the various international health organizations? What are the role of various health international organizations? Like what they do in the healthcare. So WHO, they conduct the various surveillance and vaccination programs. Then UNICEF will focus on the maternal health, nutrition, child birth, clear water access, and then the World Bank will support financial support for the infrastructure. Then Doctors Without Borders, like MSF, will deliver medical aids in the conflict zones and in the disaster areas. So this also has to be mentioned.
Okay.
Then what are the impact of the globalization on the health? There are positive impact also, there is negative impact also, right? So what are the positive impact you should write? Like positive impact in the sense there were medical advancement occurred, like because of the spread of the medical knowledge, requirement of medical vaccines, there was a impact of medical advancements. Then international collaborations have occurred, like different countries has worked together to improve the overall healthcare system. Then at the same time, there were negative impacts also. So what were the negative impacts? One is because of this travel of people across various countries, there was spread of infections occurred. And because of the westernization and diet and lifestyle, people have tend to occupy the Western culture. And they have consuming a lot of processed food, packed foods, and sedentary lifestyle. Because of those, there is increase in the rate of obesity, health issues, chronic heart conditions, and everything. So this is also one of the important topic for the exam point of view. What are the impact of the globalization on the healthcare system? Okay. Next is what are the impact of religion, spirituality on the health? So, what were the religion and spirituality on the health? There were different religious beliefs are there. Like some have faith-based healing, and some have religious fasting and restrictions. Like some believe that if they believe to the God, they will get cured, and some believe that if they take fastings and all, they will be relieved. So, this were the some of the beliefs they were having. Then what are the different medication, like cultural perspectives in the health and healing? So as I told you, there were different things, like some people believe that their illness is because of some supernatural power, or some believe it is because of the natural imbalance in their body, and some believe it is because of the dietary practices, and some believe that is family, like family will take up the decision making, and some believe that if they use a herbal medicines, they get cured. And there are different types of medications, that is traditional medications are for healing is also available, and alternatives are also available. Traditions in the sense like Ayurvedic medications, whereas alternative medications can be homeopathy, neuropathy, or chiropractic care can be given. Then what are the different barriers which can lead to less access to the healthcare services? What are the different barriers we learned? Just tell me which are the different barriers. Can you tell me which are the different barriers we learned now?
Sorry, ma'am.
Sorry?
I didn't get you well.
What are the different barriers we learned? Access
We
to the
have cultural,
health. Yeah, what are the
there are
different barriers?
cultural barriers.
Sorry?
We have cultural barriers.
Yes, cultural barriers. Then?
We have beliefs. We have different beliefs that affect health. And then we also have something like language barrier.
Yeah, language barrier. So one was geographical barrier. Okay, geographical barrier means people who are living in the rural population will have limited access to the healthcare system. So that is the one of the barrier. Second one is economic barrier. Economic barrier means due to high
Okay.
medical cost and lack of insurance,
I-
people will lack the healthcare. Yes, this is the second one. Third one is the cultural barrier, as we told. Cultural barriers are also there. That is the language difference, stigma, everything. And then next one is the government policies. Everywhere there won't be proper government policies has been implemented. So in such conditions also there are barriers. Okay. So these are the
Okay.
various barriers you should know. Clear? So now tell me which are the different barriers.
Yeah.
Tell me which are the different barriers.
We have
Yeah, geographical barriers. So what does the
geographical
geographical barrier mean?
barriers, economic barriers.
What does the geographical barrier mean?
Rural population often have limited access to healthcare facilities.
Very good.
And then
The
we have
second one,
economic barrier,
yeah. What
high
is economic
medical
barrier?
costs and lack of insurance prevent many from seeking care.
Okay. Third one,
Cultural barriers, we
yeah.
have something like language differences, stigma, and distrust in medical institutions, which hinders access.
Very good. Then,
We have government policies, regulations, and
funding
funding
impact.
impacts the availability and affordability of services.
Okay. So these are the various barriers to the health access. Next is
Okay.
how your healthcare system is structured. Can you tell me how the healthcare system is structured? Do you know how your healthcare system is structured? Any idea? So your healthcare system is divided into three types, right?
Okay.
Yeah.
Okay.
So tell me the classifications, how the healthcare system is divided.
The public healthcare,
Yeah.
which
Public
is
healthcare means
handled and funded by the government,
very good. Then
which gives access to all citizens.
very good.
Then we have private healthcare, which is handled by the private sector, handled and funded by the private sector,
Okay.
and they provide specialized services. Then we have traditional healthcare, which is indigenous and alternative medicine based on cultural practices.
Okay, very good. So this is how your healthcare system has been classified. Now, what is your health institution's role? Role of health institution? What is the role of health
Sorry.
institution? What are
The
the health institutions?
healthcare institutions have hospital and clinic research centers play a crucial role in diagnosis, treatment, and prevention.
Yes. And what is the medical professionals and social roles are?
The medical professional and social Roles, doctors, nurses, and health personnel contribute to patient care and public health.
Very good. So this is how you should answer when healthcare system structure is being asked. Okay. Next is how the environmental factors will affect the health. How does your environmental factor affect the health? How does the environmental
Environmental factors.
Yes. How does the environmental factors affect the health?
um,
Tell
I
me.
guess I didn't quite get this one, but I think
You see the
factors
slide and
like
tell me.
climate change. Okay. We have living conditions and health, poor housing, population, and unsafe water contribute to diseases and infections. Okay, and then we have climate change and health. Environmental changes affect disease patterns, food security, and natural disaster resilience. So we have workplace and community environment, safe workplaces and community resources, promote healthier lifestyle and well-being.
Yeah. So that is how your environment affects the health. Clear? Clear?
They have living conditions, and yeah, it's very clear, very clear.
Yeah. Next is how the gender affects the health.
Gender.
Yeah.
Okay, healthcare access and gender roles. That women and men experience different health risks based on biological,
And
societal
social
factors.
factor. That means usually women and men, if you compare, more chance of heart attacks and the people dying with attacks can be seen more in the male patients, because it is
Okay.
believed that woman has more tolerance to the depression, etc., whereas men has got poor tolerance. So that is one inequality they show. Second thing, they believe that women who are staying in the home, they are supposed to stay in the home itself, whereas men, they are going for work outside, so they should get more treatment. So that is what a belief people had. That is one of kind of inequality they faced. Okay. Second thing, reproductive health and gender disparities. Like people believe that women should be born at the home. Yeah.
Okay.
Read.
Access to maternal health care, contraception, and disease prevention varies globally. So we have mental health and gender. Mental health issues can manifest differently across genders. For example, women may report higher levels of anxiety and depression, while men might have higher rates of substance abuse.
Yeah. So it is believed that women should give birth at the home itself. No need for any medical care. So that is what one another difference you can see. So in such conditions, what a nurse you should do is you should teach them what are the need for the medical emergencies and requirement. Okay. Clear.
Okay.
Next is what is the role of family in a health? What are the role of family in a
Role
health?
of family.
Yeah.
We have emotional and psychological support. Families provide care and encouragement that contribute to mental well-being.
Yes.
Family also of a healthcare decision. They also take care in decision making. They take part in decision making. Family
Yes.
beliefs and values influence medical choices and treatment adherence. So we have generational health influences. Family history and genetics play a role in hereditary diseases and health behaviors.
Very
Wow.
good. That is how the family affects the health. Okay.
Okay.
Now, how does the education and employment influence the health?
Influence of education and employment. We have high education and health awareness. Educated individuals make informed health decisions and adopt healthier lifestyles.
Yes.
Employment and healthcare access. Stable jobs provide healthcare benefits and financial security, improving overall well-being.
Okay.
We have job conditions and occupation hazards. Certain occupations expose workers to health risk, affecting their physical and mental health.
Yeah. So this is how the education and employment affect the health. Clear? Now, what is the impact of socioeconomic status on health? What is the impact of socioeconomic health status on health?
Okay, we have higher income and better, that means higher income, better health. Individuals with higher socioeconomic status have greater access to health care, better living conditions, and longer life expectancy.
Very
The
good.
poverty and health disparities.
Okay.
Lower socioeconomic status in linked to higher rates of chronic illnesses, malnutrition, and limited healthcare access.
Very
Then we
good.
have healthcare accessibility. Affordability of medical services influence health outcomes and disease prevention.
Yes. So that is how there is socioeconomic status affect the health. Okay. Now, so these were the various social determinants of the health. So if a question asks which are the different social determinants of the health, you can write about this everything. Okay. Clear? Understood?
Yes, ma'am,
Understood?
understood.
Yeah. Now, what are the different
Yeah.
fundamental concepts in sociology? What are the different fundamental concepts in sociology?
Fundamental.
Fundamental
We have
concepts in
society.
sociology.
Yeah,
Yeah,
we have
society.
society. A
Yeah.
structured community of people bound by shared tradition, laws, and instructions. Then we have social institutions,
Okay.
organized structures like family, education, religion that govern social behavior.
Okay.
Then we have socialization, the process of learning cultural norms, values, and behaviors.
Okay. Then we have culture.
Then we have culture, which is shared beliefs, values, customs, and practices that shape societal interactions.
Yes.
Social stratification, hierarchical ranking of individuals based on wealth, power, and then deviance and social control, the study of behaviors that violate societal norms and the mechanisms used to enhance conformity.
Okay.
Then we have social change, transformations in societal structures due to technology movements and
Policies.
or policies.
Okay. Now, what are the fundamental concepts in anthropology?
So we have culture, learned beliefs, learned behaviors, beliefs, and traditions shared by a group. Then we
Okay.
have kingship and family, social structures that define relationships, inheritance, and family roles.
Okay.
Then we have language and communication, the role of linguistic development in cultural expression and identity.
Okay.
There's
Then
subsistence patterns, how societies sustain themselves, e.g. hunting, farming, industrial
and
economies.
so this is how the different societies, that how people sustain themselves, like how they live themselves. Like they do hunting as their occupation, some do farming, some do industrial workers, like that. Okay. So these were the various fundamental concepts and which comes under sociology and anthropology. Okay. Next is cross-cultured health studies.
Okay.
So cross-cultural health studies, you had two types: biological approach and global health and cultural factors. So what was the biological approach?
Okay. The approach that it integrates biological and cultural perspectives to understand disease patterns and health practices. The
Yeah, for
example, the
example,
case study of lactose intolerance in different populations based on genetic adaptation and dietary habits.
very good. And second one is
Global health and culture, which are medical anthropologists study how globalization impacts health, including
epidemiology and diseases.
epidemiology, epidemiology of diseases, which is like cultural perception of, we have traditional versus modern medicine integration,
Yeah,
like herbal medicine used alongside pharmaceutical. Okay.
correct. So next is, so what was the importance of medical anthropology in nursing
Oh.
healthcare? What were the importance of medical anthropology in the nursing and healthcare? What's the importance of medical anthropology in the nursing and healthcare? Any idea?
I'm thinking. Enhancing cultural competencies.
Yes. How it will help a nurse?
Okay, we have, it helps nurses and healthcare personnel to understand cultural differences in health practices and patients' expectations.
Okay.
Then we have improving patient-provider communication, which creates awareness of cultural perspectives, which leads to communication, trust, and adherence to treatment.
Okay. Then
Addressing health
disparities.
Okay, identify social and economic barriers to healthcare across and works towards solutions. Healthcare access and works towards solutions. They're supporting holistic patient care. They encourages a combination approach that considers biological, social, and cultural influence on health. And we have informing public health policies, guides healthcare policies by considering cultural factors in disease prevention and health promotion.
Then
We have integrating traditional and modern medicine, which helps to bridge the gap between traditional healing practices and biomedical approaches.
Yes. Then
we have helps in understanding global health challenges, assists in addressing worldwide health issues such as pandemics, malnutrition, and maternal health.
Very good. So that is how medical anthropology will provide a valuable insight into the healthcare by examining the cultural, social, biological factors, and therefore it enhances the effectiveness of healthcare delivery, making it more patient-centered and culturally sensitive, that you can provide a holistic care for the patient. Then it will integrate the medical anthropology into the nursing and healthcare and leads to improved patient outcome and equitable care system. Understood? Medical anthropology?
Yeah.
Okay. Now, what was the importance of, what was the scope of anthropology? Where and all you can see the anthropologist's role?
Scope of medical anthropologies.
Yes.
Cultural interpretations of health and illness. How different cultures define and understand health, illness, and healing. Yeah. Then we have traditional and modern healing practices, examining folk medicine, alternative therapies, and their integration with biomedical practices. And we have healthcare systems and policies, analysis of healthcare accessibility, quality, and effectiveness in different societies.
Yeah, then?
We have a doctor-patient relationship, how communication, trust, and cultural beliefs influence healthcare delivery. Health disparities and social determinants of health, studying inequalities in healthcare due to socioeconomic, racial, and cultural differences. Then we have epidemiology and disease patterns, investigating the spread control and cultural impact of diseases.
Yeah, so your anthropology, medical anthropology will investigate the like how that disease have been spread in your community, or how to control, what are measures has to be taken, and what are the cultural impact of that disease in the society. All this will be taken care by the medical anthropology. Okay. Then biocultural perspectives on health.
Examining how genetics and environmental factors interact with health, beliefs, and behaviors. Medical ethics and global health issues, addressing ethical concerns in healthcare and global medical challenges.
Yeah, so these are the roles where your medical anthropology has got a scope. Now, what is medical anthropology? How can you define medical anthropology? What is the definition of medical anthropology?
Okay, medical field of anthropology that examines how cultural, social, biological, and environmental factors influence health, illness, and medicine practices. Wow. No, I didn't get it from the beginning, so I'm actually understanding it now.
So medical anthropology means like how the various culture in a society, there are different cultures, right? How that culture and various sociological and biological factors along with the environmental factors, how that influence the health of a community, health, medical practices of a community. That is what you call it as anthropology. Okay, how the cultural, how the behavior, how the environmental factors all will influence the overall health of a community, overall illness, overall medical practice of a community is what anthropology means. Okay. Whereas medical sociology means like how a group of people interact among themselves.
Okay.
When they are in a society. So that is
Okay.
what medical sociology is mean. Clear?
Very clear, Mom.
Okay. Now, what is the importance of medical sociology in nursing? What are the importance of medical sociology in nursing?
Holistic patient care.
To provide
It helps to
holistic
understand
care.
social factors affecting health.
Okay.
Okay, cultural competence, adapting nursing care to diverse populations.
Okay.
And we have health education and promotion, encouraging healthy behaviors in communities.
Okay. Then
Improving communication, enhancing nursing, nurse-patient relationship, addressing health inequalities, advocating for vulnerable populations, policy making and leadership, contributing to healthcare reforms and policy improvements.
Thus, your medical sociology will provide a valuable insight into the healthcare and the nursing practice.
Yeah.
And it will help the nurses to understand the patient beyond the medical condition. And thus, medical sociology plays a critical role in developing a patient-centered care and improving the overall healthcare system. Clear?
Okay.
Now, there is a scope of medical sociology is there. Where are your medical sociology as a role?
You have social determinants of health.
Yeah.
Which examine the impact of social, economic, and environmental factors on individual and community health.
Okay.
Then patient behavior and compliance investigates how social norms and cultural beliefs influence health-seeking behaviors and treatment adherence.
Okay.
Okay. Then we have healthcare policies and reforms, analyzes the development and impact of healthcare policies, insurance systems, and reforms on public health.
Okay.
Then health disparities, studies differences in healthcare as based on socioeconomic status, race, gender, and geography.
Then mental health in society.
We have mental health and society, which explores the sociological aspects of mental health, stigma, and access to mental health care. We have workplace dynamics in healthcare, which focuses on the roles, relationships, and challenges faced by healthcare personnel in medical institutions. Okay. Then we have technology and healthcare, investigates the impact of medical advancements, telemedicine, and digital health solutions on society. Then we have end-of-life care and ethics, examines ethical issues, palliative care, and the role of sociological perspective in death and dying.
Very good. So these are the places where your medical sociology has got its role. Now, what are the key concepts in medical sociology? What are the key concepts in medical sociology?
We have health and illness, social determinants of health, and cultural perceptions of illness. We have healthcare system, structures and functions of healthcare, organizations, which examines the structure, function, and efficiency of healthcare organizations globally. And this includes analysis of healthcare policies, accessibility, and quality of care.
Okay.
And we have
Then,
doctor-patient relationship, develops trust, communication, and power dynamics, influence medical interactions, examines the role of empathy, medical authority, and patient autonomy. Then we have health inequalities, impact on socioeconomic status, race, gender on health.
then,
And we have medicalization, how social issues become medical problems. The process where non-medical issues become defined and treated as medical problems. Examples include mental health issues,
yeah,
mental health
yeah,
disorders, childbirth and aging. Then we have social epidemiology,
epidemiology.
which is a pattern of disease in populations. Epidemiology, okay.
Yeah.
A pattern of disease in populations. Analyzes how factors like poverty, environment, and lifestyle contribute to health conditions.
Okay. So these are the key concepts comes under the medical sociology. Okay. So what was medical sociology definition? What was the medical sociology definition?
Sociology is the scientific study of society, human behavior, social relationships, and institutions.
Very good. And
It
this
examines how
experiment,
individuals and groups interact within a structured society.
yes. And then it focuses on
Sociology focuses on patterns, culture, norms, and social dynamics.
very good. So this is what sociology and your medical anthropology is about. Okay. So I hope this class was clear for you, isn't it?
Okay.
Class was clear? Any doubt?
No, ma'am, we just go home and reinforce the reading to understand better.
Sorry?
I say no doubt, we'll just need to read more to understand better.
Okay, I'll send the slides also so that you can read it and you can see whether you have any other doubt. Okay?
Okay, ma'am.
Hope today's class is clear to you. I'll send some videos and also with the same so that you can read it and you can read the conclusion once again. If you don't mind, can you read the conclusion once again?
Okay.
Yeah, read it.
Sorry.
Yeah, read it once.
I never had.
Just read it once. So your sociology and anthropology provides an essential framework for
Okay, the
understanding the
conclusion.
health behaviors. Okay, just read it once.
Yeah. Sociology and anthropology provide essential frameworks for understanding health behaviors. Culturally informed practices lead to better health outcomes and patient satisfaction. Interdisciplinary approaches are key to meeting evolving healthcare challenges.
Very good. So that is all about today's class. Hope you understood everything.
Okay.
Hope there is no doubt in the class. So I'll end up today's class, okay? Thank you for your cooperation. Thank you for listening to the class. Okay, thank you. Thank you, students.
Sorry, ma'am.